If you're thinking about becoming a dental hygienist or you're already in school to be a dental hygienist, this video might save you from some real disappointment down the road. I'm Chris, I'm an RDH, a combat veteran, and someone who's been in the trenches of this industry for some years now. Let me give you the real talk that no one else is gonna give you. Look, I love this profession. I've built my entire career around it. But when I was sitting where you are right now, there were some things that I wish someone would have been honest with me about. So I'm gonna share 5 pieces of advice to help you decide if this path is right for you. And if it is, how to thrive in it. Because here's the thing, less than 5% of dental hygienists are actually men. So I bring a pretty unique perspective to the conversation. First, I can't stress this enough, understand what you're actually getting into. Dental hygiene is no joke. It's intense, it's expensive, and it's competitive. But more importantly, you need to understand what the day-to-day reality of this job actually looks like. You're gonna be hunched over people's mouths for 8 to 10 hours a day. You're gonna deal with difficult patients. You're gonna have to navigate office politics and production pressures. And depending on where you practice, you might have very little autonomy over your own clinical decisions. Before you drop tens of thousands of dollars on this education, shadow multiple hygienists in different practice settings. Don't just do it once, do it for full days, multiple times. See what corporate industry looks like versus private practice. See what different state regulations mean for your scope of practice. Make sure you actually love the clinical work, not just the idea of healthcare. Second piece of advice, your clinical skills are everything. I don't care how good you are at social media or how well you network. If you can't perform clinically at a high level, you're going to struggle. In school, master your instrumentation. Get obsessed with it. Stay late in the lab. Practice until your hand scaling is impeccable. Understand periodontal disease in and out. Learn to actually educate patients, not just lecture at them. Because here's what happens. When you graduate and you're confident in your clinical abilities, you have options. You can work anywhere. You can negotiate better. You can set boundaries. But if you're constantly worried about if you're doing a good job clinically, you're going to accept whatever conditions an office offers you. That's how you end up burned out in 2 years. Third, and this is huge, the office culture matters more than your starting hourly rate. I've seen hygienists take $5 to $10 more and end up miserable because the workplace is toxic. Pay attention to how the team communicates. Notice how the doctor treats their staff. Ask about turnover rates. If hygienists are leaving every 6 to 12 months, red flag. You're gonna spend 40 plus hours a week in this environment. A practice that respects you, values your clinical judgment, and treats you like a professional partner is worth so much more than a few extra dollars an hour. Trust me on this. And when you find that right fit, learn the 5 languages of appreciation. Understand how your team members want to be valued. This framework will transform how you show up in an office and how you build relationships with your colleagues. It's been a game changer for me. Matter of fact, there's the book right here, and I actually speak on how to implement the 5 languages of appreciation in the workplace. Fourth point, you are a licensed healthcare professional. Act like it. One of the biggest frustrations I see in this profession is hygienists who allow offices or corporations to treat them like glorified cleaning techs. You went to school for periodontal disease diagnosis and clinical treatment. You're trained in patient assessment, medical history evaluation, and clinical decision making. Don't let production pressures compromise your clinical standards. Don't let a doctor override your professional judgment without good reason. And don't stay silent when you see things that aren't in the best interest of patient care. This is hard, especially when you're new, but the profession needs advocates who will push for dental hygiene autonomy and elevate our scope of practice. We need people who speak up about systemic issues and demand better for ourselves and our patients. If you're not willing to advocate for yourself and this profession, it's going to be a long, frustrating career. Okay, my 5th and final piece of advice is build your career with intention from day one. Clinical dental hygiene doesn't have to be your only path. There's speaking, consulting, public health, research, product development, so many opportunities. but you have to be intentional about building toward them. Start networking now. Connect with other hygienists on LinkedIn, on Instagram. Follow Facebook groups. There's a bunch of different dental Facebook groups where people share and connect all the time. Go to conferences if you want that in-person opportunity. Learn about the business side of dentistry. Understand vendor relationships and practice operations. Develop skills outside of clinical work. And whatever you do it with love. That's my philosophy. Whether you're doing a pro fee or building a side business or advocating for the profession, bring your whole heart to it. That's what separates people who survive in this career versus those who thrive in it. Also, get comfortable with being uncomfortable. As one of the few men in this profession, I've had to navigate being different, but that perspective has become my strength. Whatever makes you unique, lean into it. So there it is. 5 things I wish someone had told me before I became an RDH. If you're still in school or thinking about applying, take this seriously. This can be an incredible profession, but only if you go into it with your eyes wide open and commit to being excellent at it. And if you're already practicing and struggling, remember, you have more power and more options than you think. Don't settle for less than you deserve. Drop a comment and let me know where you are in your journey. And if this was helpful, share it with someone who needs to hear it. Whatever you do it with love.